we'll start with looking at the psychiatric drug issue and the mental health issue through an informed lens. And I'll just start by saying there's not a single study that shows that chemical imbalances in the brain are caused by any type of there's not a single study, I should say, that shows that ADHD or any of these conditions are caused by chemical imbalances in the brain. And that ranges from ADHD to schizophrenia. There's no method, by the way. Well, actually, there is a method for measuring serotonin levels and other neurotransmitters in the brain. You have to grind up the brain and assay the material, and we think that that's generally a bad idea as a testing mechanism for people like you. Now, one thing is that there are metabolites for neurotransmitters like serotonin in the cerebrospinal fluid, and you can test for that. And interestingly enough, there are quite a few studies that have shown that people who are depressed have high levels of metabolites, people who aren't depressed have low levels of metabolites. So the issue that serotonin levels are a cause of mental health issues is just patently false. We don't have any evidence that shows that. And just going to the point, there's a guy by the name of Dr. Ronald Pies, who's a well-known psychiatrist, and at one time, he was head of psychiatry at Tufts University. He used to be editor of Psychiatric Times, and I think that his public statements about this issue indicate where the psychiatric profession is on this issue. One time he said, in truth, the chemical imbalance notion was always kind of an urban legend, never a theory seriously propounded by well-informed psychiatrists. Well, that's interesting because they're all drugging people. My impression is that most psychiatrists who use this expression feel uncomfortable and a little embarrassed when they do so. It's kind of a bumper sticker phrase that saves time and allows the physician to write out that prescription while feeling that the patient has been educated. And when pressed further, he said that the chemical imbalance theory was a little white lie. Well, it's a little white lie that has resulted in the drugging of massive numbers of people. So 1 in 6 adults in the United States right now reports taking at least one psychiatric drug. 84.3% of the people who take them use them in the long term. An analysis of 522 trials involving 21 antidepressant drugs with over 116,000 patients shows that they're barely better than placebo. And the public has been told that the drugs make life better for patients, but the data shows something else. Every single day in the United States, 850 adults and 250 children who take these drugs are placed on permanent disability. And you know, the opiate epidemic, we know what a disaster that is, both from a public health standpoint, individual health and family health standpoint, and financial burden. It pales in comparison to this. It pales in comparison. Part of the problem is disease mongering, which I talk about often. The Diagnostic and Statistical Manual grows every year, and they keep inventing new diseases. So right now, caffeine withdrawal is a psychiatric condition. Hoarding disorder, PMS, social communication disorder. I think a lot of doctors suffer from that. They should self-medicate. Central sleep apnea, neurocognitive disorder, and restless leg syndrome. I'm wondering how you convert that into a psychiatric condition, but actually it's considered one. Now, what this means is that there's about a 50% chance that when you visit a doctor's office, you can be medicated for some type of psychiatric condition. Now, part of the problem is that doctors in all medical specialties are now prescribing the drugs. In fact, there's a great book called Artificial Happiness by Ronald Dworkin that I highly recommend. And he talks about how people in the United States have been taught to think that everybody should be happy all the time. It's a right and privilege of living here. And I don't know about you guys, but I've not been happy for 63 years in a row. Sometimes bad things happen, right? But there's a chapter in there about how doctors in family practice got kind of aggravated sending patients to specialists to make a lot more money than they did. And family practice docs did an all-out campaign to maintain control over the prescribing of antidepressants to their patients. And so what happens is, you know, the shorter and shorter visit is the order of the day, so people go into a doctor's office and the doctor says, how are you doing? Well, think about malnourished, overweight, sedentary, dehydrated people going into a doctor's office. They usually don't say, I feel marvelous, right? So they say things like, I don't know, I'm kind of tired, I sleep a lot. You know, in the wintertime, I feel a little bit blue, I don't go anywhere. And this sounds remarkably like depression, and this often results in a diagnosis and an antidepressant is prescribed. In fact, Dworkin, in his book, mentions a study in which people were sent into into a GP's office and basically told to say, in response to how are you, I'm having a tough time. I've lost my job, finances are tight, and I'm getting divorced. And half the time, without any further discussion, people were given a drug. Pretty scary. So right now, every time somebody has a negative thought or emotion or behavior, it's now considered pathology that requires treatment. And the standard of care treatment is drugs. And this ignores the fact that there's a relationship between diet and lifestyle habits and mental and psychological health. The problem is the drugs are easy to prescribe and not very easy to de-prescribe. So, there we go. Drug withdrawal is very difficult, and the reason is that there's nothing the matter with your brain when you start taking these drugs, but they do alter your brain when you take them for a while. And withdrawal often means that people have extremely distressing symptoms, sometimes dangerous. The brain can be very slow to recover, and the compensatory effects don't go away very quickly. Judgment and self-control can be quite impaired. Severe depression, mania, psychosis, violence, and suicide can be a result. And the original problems that led the person to take the drug in the first place resurface, and sometimes resurface considerably stronger than before they were drugged. It's interesting, prescribers often don't know how dangerous the drugs are, and they don't understand why the patient would want to withdraw. And the biggest reason why I've experienced people wanting to withdraw is because the drugs don't make them happy, they make them numb. And there's a difference between blunting negative emotions and living a spectacular life. Nobody ever lives a spectacular life by blunting the emotions that they're having that are unpleasant. And one thing that I tell people all the time is to watch that movie, Oh God. How many of you people saw it? Anybody see that with George Burns? And one of the most poignant moments in the film is when the little girl asks George Burns, playing God, why, if you're God, do bad things happen? And he says to her, his answer is, it's interesting. I didn't know what else to do because I couldn't create an up without a down and a front without a back and a high without a low. And so when you are drugged, you don't feel the strong negative emotions, but you don't feel the strong great emotions either. And after a while being in a fog, some people say, you know what, I don't think that I should have signed up for this, and that's why they want to get off the drugs. It's hard to find somebody to assist, and what happens is that often people will go back to their prescriber, sometimes psychiatrists who are not very friendly, who will say, well, if you think you want to try life without drugs, then just go on ahead and stop taking them. Well, I don't know if you know anybody who's done that, but it's usually fairly disastrous. Sometimes people end up hospitalized, they have a psychotic break, and then the psychiatrist says, well, see, you needed to stay on those drugs the whole time. And so what we tell people to do is this has to be, it's like building a house. You need a blueprint, right? Nobody just starts stacking wood and bricks and that sort of thing when they're building a house. So if you're going to do this and do this successfully, then you need to have a plan, you need a team, and you need a prescriber to work with you, and you need to have a very gradual approach to doing this. And in addition to that, you've got to start building a strong, healthy body to help you withstand the difficulty associated with the physical symptoms of withdrawal from the drugs. A study in Puerto Rico, including 80 subjects between 27 and 70 years old, two groups, vegetarian and non-vegetarian. More anxiety and depression was reported in the non-vegetarian group. 18-week randomized controlled study with 292 participants eating a vegan diet. The vegan diet resulted in improvement in depression, anxiety, and productivity. Study of vegetarians, vegans, omnivores, and I'll read this quote, increasing restriction of animal foods. In other words, conversion from vegetarian to vegan is associated with improved mood. So the closer you get to more and more plant-based, the happier you're going to feel. For a lot of reasons. It'll make me happy, for one thing. And we all know it's all about me. I'm kidding. All right. Adolescents are profoundly affected. I mean, we have a big problem with adolescents, teen suicide. I've written a lot about what's wrong with our children from a mental health perspective, and some of it requires a societal fix, but there's no question that the food has an influence. A study of over 3,000 adolescents, 11 to 18 years old, subjects with poor dietary pattern developed more emotional and behavioral problems. They worsened over time if the poor diet was continued, but they got better if the kids' diets improved. Subjects with good diet at baseline had fewer psychiatric problems, but if the diet worsened, so did mental health. A healthy diet was defined as consuming fruits and vegetables and avoiding junk food. And in a lot of these studies, most of the people didn't eat perfect diets, they ate better diets. And that goes to something that I've talked about a lot at this conference, is that the better the diet is, the better off you're going to be. But I think it's important that we don't misrepresent the idea that smaller changes can result in profound differences in health. Data from almost 3,000 ethnically diverse adolescents showed an association between diet and mental health problems. Adolescents eating unhealthy diets, the highest quintile of eating processed and junk food, and less fruits and vegetables, were more than 2 times likely to have psychological problems than kids eating healthier diets. Case control study of 849 teenage girls. Consumption of ramen noodles, hamburger, pizza, fried food, and other processed foods increased risk of depression. Green vegetables, fruit, higher intake of fiber, decreased risk of depression. A random sample of over 5,000 Chinese adolescents looking at 3 dietary patterns: lots of snack foods, animal foods, and traditional. And places like China are great places to do these studies because you have the whole spectrum of diets ranging from just like the United States to very traditional. Higher intake of snacks and animal foods, higher risk and incidence of negative psychological symptoms. And adolescents in the highest quintile for the traditional diet had the lower risk of depression. Cross-sectional study of over 4,200 adolescents in New Zealand eating a healthier diet associated with better emotional health. Unhealthy dietary pattern, more negative emotions. Unhealthy eating pattern, soft drinks, unhealthy snacks, high fat foods, and sweets. The way that the average teenager in the United States eats, and unfortunately the way that the average teenager all over the world aspires to eat. You know, it's unfortunate, but of all the things we could export in this country, we've had to export the thing that is debilitating the population most, which is the Western diet. A prospective cohort study of over 20,000 women and their children. Higher intake of unhealthy foods during pregnancy was predictive of behavioral and emotional problems in kids. And women who eat a terrible diet postnatally, higher risk of behavioral and emotional problems in children. So it starts basically preconception and during pregnancy. In 1933, psychiatrist Joseph Kilman wrote, see, we've known about this stuff for such a long time. It's far from our mind to conceive that all mental conditions have the same etiological factor, but we feel justified in recognizing the existence of cases of mental disorders which have as a basic etiological factor a toxic condition arising in the gastrointestinal tract. Written in 1933. One of these days, I'm going to start my own medical journal. I'm going to call it the Journal of Forgotten Research, where we're going to put all the stuff we've known about forever in one place for people to read it. Negative changes to the microbiome are common in conditions that are associated with high incidence of depression, IBS, chronic fatigue, obesity, and type 2 diabetes. Antibiotics and NSAIDs often affect mood because they wipe out huge swaths of the microbiome. The most vulnerable to the effect of antibiotics are the beneficial bacteria, and the pathogenic bacteria are pretty resistant to the effect of antibiotics and NSAIDs. So you end up with inflammation in the gut, destruction of beneficial bacteria, and you can not only end up with physical conditions like autoimmune diseases and allergies are common manifestations, but you can end up with negative psychological state as well. And in fact, we have a lot of studies showing that antibiotics are related to psychological issues. One example, analysis of patient records showed that people with serious mental disorders who were hospitalized for mania were more likely to be taking antibiotics for infection than people hospitalized without psychological problems. And a lot of studies have shown that taking antibiotics is a risk factor for psychiatric and behavioral problems. And in addition to the destruction of the bacteria, it might be related to mitochondrial dysfunction as well. One thing, if you want to have a healthy microbiome, there's no question that a plant-based eating pattern is the best way to get there. Vegan diets have a positive effect on inflammation-related disease, and inflammation affects everything, including your mental health. I'll just read this, just a piece of this is a quote from the study. The vegan gut profile appears to be unique in several characteristics, including a reduced abundance of pathobionts and a greater abundance of protective species. So again, the closer you get to that plant-based eating pattern, the healthier your body's going to be, the healthier your emotional state, and the healthier your bacteria in your gut, which has a huge influence on your emotional state. So if you've wiped it all out, in addition to changing your diet, you may need to take probiotics. And there's some very provocative studies about this. In experiments on mice, probiotics lower anxiety levels. One lactobacillus formula was given to 16 healthy mice, and 20 controls were given a bacteria-free solution. And when stress tests were administered, the mice given bacteria ventured out into the open a lot more. They were more likely to struggle instead of giving up when forced to swim. The effects of probiotics were very similar to the effects of antidepressants. Now, for the record, I'm going to tell you I object to this type of research, but it's out there and it's done, so we might as well use it. An Irish psychiatrist, I think I went too far. John Cryan is an Irish psychiatrist, and he did some studies on rats and showed that bifidobacterium reduced depression and anxiety symptoms as much as Lexapro. And this is important. There are other studies that have confirmed this. Now, when you go home today, look up the side effects of Lexapro. And I think that you will agree that probiotics, which are significantly less expensive, not addictive, are a much better alternative. IBS patients. Twice as many patients taking a probiotic reported improvements in depressive symptoms as controls taking a placebo. And a double-blind placebo-controlled study, 30-day supplementation with lactobacillus and bifidobacteria lowered psychological distress and depression, decreased anger and hostility. Low-grade inflammation is associated with psychological disorders and actually most physical disorders as well. Probiotics lower inflammation levels. Oxidative stress has been known to be a cause of depression and an effect of depression. Even skin biopsies of depressed people show higher levels of oxidative stress, and taking probiotics has been shown to lower oxidative stress. I had trouble with this the other day, but okay. I think a review of 10 studies concluded that daily probiotic supplementation can improve mood, anxiety, and cognitive symptoms in people with major depression. The most significant effect was on anxiety. Researchers concluded that the use of probiotics for major depression and anxiety could be important due to the limitations of drugs, including the fact that they are often ineffective and there are safety issues associated with them. A randomized double-blind placebo-controlled trial of chronic fatigue patients given 24 billion CFU probiotic or placebo for 2 months, significant changes in the microbiome, significant decreases in symptoms of anxiety. A review of 5 studies showed that taking probiotics resulted in significant reduction of depression and reduction in the risk of depression. And there are hundreds of studies like this. Now, one of the things that I think is interesting about the gut microbiome and these bacteria, how can these single-cell organisms have so much influence on the totality of who we are? It's amazing how smart they are. In fact, they can live outside your body. You know, we need them more than they need us, which is interesting. And one thing I'll share with you about the power of single-cell organisms, there's a bacteria that lives in the guts of cats, and the bacteria likes it there. T. gondii, I think is the name of it. And so when cats excrete, when they have a bowel movement, the bacteria come out. And rats, I hope nobody's eating breakfast while I tell you this, but rats like to eat cat poop. And so the bacteria end up in the rats. But the bacteria doesn't want to be there, so they hijack a portion of the rat's brain that makes the rat afraid of cats, so the rats hang out with the cats, and the cats eat the rats, and the bacteria end up back in the cat where they want to be, all right? So these are pretty smart critters, and I think that when we don't take care of the bugs in our gut, we do this at our own peril in a major sort of way. So be nice to the bug guts, or the gut bugs, rather. And one thing I'll tell you, too, is this happened a long time ago where these creatures decided to live inside of other creatures. Like even flies have a microbiome, and ants. Now, it's much tinier compared to ours, but all living creatures have a microbiome. And so the agreement that got made, in real simple terms, when these microbes started moving into humans is, okay, here's our agreement. You get to live inside of me. You get to see the world on me, and I'll take care of the food. And then in return, you're going to make it easier for me to stay in a stable mood state. You're going to help control my immune system, help me absorb nutrients from foods, and all these kinds of things. But here's the problem, folks. We have violated that contract big time. And so we have to go back to feeding the gut microbes what they like, and the good microbes like carbohydrate and fiber. And also using probiotics to replace the microbes because they're not part of our body. So if I scratch my arm, I can fix it because my body can heal itself. But if I destroy my microbiome, I can't necessarily fix that. It's like if I own an apartment building and the tenants move out, I have to go find new humans to live in the apartment, right? So that's why probiotics can be very, very helpful in terms of replacing damaged or non-existent beneficial bacteria. I never miss an opportunity to talk about exercise because everybody needs to do more of it, and so any additional motivation that I can give you to do it, I'm going to do that. So research shows that inactivity is associated with the development of psychological disorders. Increased physical activity is associated with lower risk. Now, there's a circular thing to discuss here. Does being sedentary to contribute to depression, or does being depressed make you more sedentary? And I think a little bit of both are going on. But to break that cycle, you have to start exercising for a whole lot of reasons, not just this. So I'll show you some studies. Now, this one was interesting for a dose-dependent reason. So 561 volunteers at a university chose to exercise or not, and then how much exercise to engage in. And the active groups had lower depression scores, but what was interesting is that the more they exercised, the lower the depression scores got. So a dose-dependent effect is always something that we look at as a way to strengthen an association between two things. And what was interesting in this study, too, is there was a wide spectrum of types of people in this study. And so active, normal, and depressed students got better. So some people aren't depressed and they don't have anger issues and that sort of thing, but they can still get better. They can feel better if they exercise. 30 community-dwelling, moderately depressed adults randomly assigned to exercise, social support, or a wait list control. The exercise intervention, it was nothing huge. They were just walking 20 to 40 minutes 3 times a week for 6 weeks, and exercise was the most effective at relieving depression. Participants were randomized in another study to exercise on a cycle for 30 minutes 4 times a week, or a control group, and compared to the controls, those who did the exercise were significantly better off. And what was interesting is 3 months later, they were still better off. Now, that doesn't mean that you can exercise for a few weeks and stop, just to be clear about that, right? You have to keep doing it. And that's where the problem is, right? Keeping doing it. But if you can make it a habit, it helps with an awful lot of things. I'm going to make this go back. Just 30 minutes of treadmill walking for 10 days resulted in a statistically significant reduction in depression. And what's important about this is people who are depressed or anxious, they want to feel better not by Christmas. They want to feel better by the end of the month. And you can get some very quick results with exercise. In fact, the drugs are so ineffective, and I don't know if you've seen the ads on TV, like if your current antidepressant isn't working, add Abilify, right? So a lot of the drugs, even though the promise is that they can make you feel better instantaneously, it actually doesn't work out that way in practice all the time. So you're actually better off exercising your depression away and your anxiety than using the drugs. Depressed adults who engaged in 12 weeks of training versus controls, the training groups had larger drops in depression and anxiety than the controls, and a year later, that was maintained. And I'm sure some of it was because some of those people continued to exercise. And again, you can't store exercise so that you don't have to do it. Resistance training reduces the symptoms of depression. A study comparing running and weightlifting versus control, both types of exercise were terrific. The controls got slightly worse, while those exercising got better. Running is as effective as psychotherapy in relieving depression. And we have a biological mechanism for that, which I'll share with you in just a minute here. 156 depressed adults randomly assigned to exercise, medication, or both for 16 weeks. The medication worked more quickly, but at 16 weeks there was no difference. And so researchers concluded that in the long term, exercise was as effective, and there are no negative side effects. 10 months of follow-up, the exercise group was still better off than the medication group or the combination groups. So what you could say is the drugs are so bad that it blunts the effect of the exercise. That's pretty bad, right? Better to work out. An analysis of 30 studies showed the most important factor in efficacy of exercise for depression was length of exercise. You had to do it for 9 weeks or longer to get an outcome. So sometimes people will ask me, because we own an athletic facility in our building and we have a hot yoga studio, and they'll say, okay, you've talked me into it, I'm going to start working out, am I going to like it? And I tell them, no, you're not going to like it. It's going to be awful in the beginning. It hurts and everything's uncomfortable. They'll say, well, I'm going to come to those hot yoga classes. Am I going to like it? I go, no, you're going to hate it. It's hot. You're going to sweat. You're going to have to sit down a lot. You know, I mean, just be honest with people. But if you can get them past that initial period of time where everything's uncomfortable and the muscles hurt, it really starts to get easier and people look forward to it. And so you just have to stick with it. And it's equally effective for men and women, all ages, and for people who are severely depressed. So obviously the challenge, if you're severely depressed, is to get you to exercise. But once you cross that threshold, things start to get better. Exercise has proven effective also for anxiety and panic disorder. A study of 24 people with severe anxiety randomly assigned to aerobic exercise or no exercise control, and a lot less anxiety after exercise. And that's not surprising. I mean, I'm a runner, and I don't know about you guys, and how many people in the audience are runners? Like runners, okay. How many of you, if things are really stressful, like you've had just a god-awful day, or you find yourself with an hour in the middle of a god-awful day, find that if you just go out for a quick run, even if it's 2 miles, you feel better? Yeah. And I'll do that. You know, fortunately, I work for myself, and I have that kind of freedom, and I have all the stuff right in my building if I want to do it. But I found that the best thing to do to get my mood set for whatever I'm going to do in the evening, teaching or whatever, just go out for a quick run. Resets you right away, right? A review of 31 articles showed that regular aerobic exercise improved anxiety and panic disorder, and lots of studies showing that it reduces levels of neuroticism, anxiety, and depression. And I think the problem is it's just hard for people to believe that something so simple and free, good running shoes is all you need to get out the door and go for walks or runs, could actually be so effective. Now, this was very interesting. 128 men hospitalized with major depressive disorder, anxiety disorder, alcohol addiction, toxicomania, psychotic decompensation, and bipolar disorder. Those who participated in physical exercise showed significant improvement in mental health. Patients with major depression showed the most interest in exercise and spent more time at it, and the best results were from cycling and hard gym workouts. Now, if you can take a group of people who are in this psychological state, and they're willing to exercise, the ones in the worst shape were the ones who said, I'll do it, probably looking for relief in any way they could find it. And I mean, this is really, if you could put exercise in a pill, we'd all be billionaires if we owned an interest in the drug company that made it, right? Unfortunately, you can't do that. You actually have to do the exercise. Let's talk about exercise and addiction, which is closely related to mental health. Just 10 minutes of moderate intensity cycling reduced alcohol cravings in adults who had recently completed a treatment program. I subscribe to Runner's World, because I'm a runner, but I love the inspirational stories, a lot of which are about people who had addiction problems who helped to resolve their addiction problem from running. The review showed that exercise can be helpful at all stages of addiction, regardless of which substance the person has become habituated to. It can serve as an alternative to drugs and a means to prevent relapse. And I remember somebody saying one time, well, I think some of those people you're helping have just become addicted to exercise instead of drugs. And I'm saying that's a bad thing, right? Okay. If you're switching addictions to exercise instead of drugs, I'm all for that form of addiction. I think it's great. Okay, so what is the mechanism? Well, exercise helps repair some of the damage to the brain that can result from taking psychiatric drugs or abusing opiates or street drugs. Brain-derived neurotropic factor, BDNF, assists in brain cell communication and cognition and increases the production of GABA, a neurotransmitter that assists humans in achieving calmness and reduces anxiety. So exercise improves the production of BDNF, which improves your brain, your mood, your intellect even. That's why I'm so smart, actually. It's the production of BDNF. Just kidding. All right. Children with ADHD randomized to participate in a 10-week exercise program or control for 10 weeks. The kids in the exercise group did better. Is anybody surprised about this? I mean, our kids need to run around and play. And one of the things I'm completely opposed to is this structured preschool where we're sitting down and learning. At 3 years old, my sister and I were running around the backyard and getting dirty every day, not sitting in a class trying to learn something. So I think part of the problem is kids don't get enough exercise, and we need to promote more of it at an earlier age. A meta-analysis of studies looking at exercise in ADHD, aerobic exercise was particularly helpful and resulted in improvements in executive function, attention, behavior, cognitive, and socio-emotional factors. A review of exercise and ADHD showed symptoms of ADHD improved with all types of exercise interventions, and it affected social behavior, motor skills, strength, and neuropsychological measures. And no negative side effects are reported. You take a look at these drugs, the side effects are heinous. Eating plants and exercise, there are no negative side effects other than the adjustment period to get used to it. And I do own a yoga studio, full disclosure here. Yoga is great for mental health. I can testify to it. One of the reasons I am not in the asylum is a yoga studio is in my building, and I go several times a week to yoga in addition to teaching yoga. And you'd be surprised how many of our students say that, even to the point that sometimes it'll be a crazy day in our office, and I'll say, I don't know if I should go to yoga or not. Everything's so busy. And you know what my staff says? No, you should go to yoga. Actually, you go, we're fine. And the reason why they say that is because they know that life for the next 12 hours will be a whole lot better if I go to yoga first. So some studies show that yoga is as good as antidepressants and in fact has the same effect on the brain as antidepressants. It increases serotonin levels, lowers inflammation, reduces oxidative stress, clears your mind, can't say enough good things about it.